This video is to talk about outpatient physical therapy and its very poor response to COVID-19 or the coronavirus. Before I go into that, I'll tell you a little bit about me. I earned my master's degree in public health from Nova Southeastern University's College of Osteopathic Medicine, where I studied epidemiology, infectious disease, tropical disease, viral diseases, and then worked for a drug development firm studying them as well as we developed vaccines. After that, I earned my doctorate in physical therapy from the University of Miami. So even though I'm a practicing PT, I do have experience studying and practicing in public health. And what we are seeing now is a very poor public health response by outpatient physical therapy clinics. Now doesn't come as a surprise to many of you, because many of you as students, techs, practitioners have seen many PTs not wipe down equipment, reuse resistance bands, share electrodes, have people come in coughing, and like it's no big deal. If this behavior continues, it's gonna become a big deal. We're seeing a lot of top PT gurus go around and say how to keep your practice open. That is not a priority right now. Your profits are gonna take a back seat to the public health problem we are facing. Now, a week from now, we could be like Italy, we could not be, but we should do everything in our powers to make sure that we take preventative measures. Now, I gave some examples of these poor public health practices as far as infection control. So if you're at a clinic where they're not giving you masks, they're not taking patients' temperatures, they're not asking screening questions, they're allowing people to be in the clinic with a cough, there's providers there with a cough, all of these things, and it's a high volume clinic where there's more than 10 people in there at a time, I suggest that you do not participate in that. If you're a practitioner, quarantine yourself. If you're a practice owner, it's time to put your profits on hold and study infectious disease and make sure that when you come back up, you do have these principles in place so we can stop the spread of infection. Now, we are lower risk than other providers, obviously, but at the same time, these simple preventative measures in place can reduce the spread of not only this, but many other diseases. This is showing how PTs are actually very, very poorly prepared for infectious disease and infection control based on the small examples I highlighted on a much smaller scale of what's actually going on. The fact that many clinics are remaining open and not even giving their personnel masks or anything like that shows a much bigger problem. You want to be respected as public health professionals, as medical professionals. Please understand what is going on and please act appropriately. Now, again, I'm a physical therapist with an MPH. I'm not saying I'm an expert epidemiologist, but I'm saying I have more public health training and more work experience in public health than many physical therapists, and I urge you to listen to me and do what's best for you and your patients, especially if you're seeing a lot of Medicare patients. Make sure you mitigate their risk, you mitigate your risk, and mitigate the risk to your loved ones. Hopefully this video is giving more context to some posts I made in the prior days, and I hope everyone gets through this okay and just takes the appropriate steps, and moving forward, continues to implement measures that were implemented now. Again, that's gonna be no coughing patients in the clinic, especially for PT, no coughing providers in the clinic. Please wipe down stuff. Please just make sure you understand how disease spreads, various types of disease. Just be safe, listen to the public health experts, and listen to the CDC, the WHO. Don't go on Facebook and go to a mom's group and see that gargling salt water, smoking marijuana, and eating bananas is gonna cure this. Please be smart, please listen to the scientists. We are already in phase 1 trials for this vaccine, but please just be smart, do what you can today, and you can save many lives tomorrow. Even if that means putting your profits on hold for a bit, look at the bigger picture. Again, I'm a physical therapist with an MPH. I thank you for watching. Thank you.